In 2022, Mpox was declared a public health emergency of international concern. Since then, the virus has continued to affect thousands, especially across Central West and East Africa. Communities are facing fear, disruption, and stigma. The risk of wider global spread remains real, and the need for a united, coordinated response has never been greater.
So from the time the declaration was made in August, we sat down and then we looked at the trends of the Mpox outbreak starting from DRC, the epicenter. And we agree on the different pillars that will lead the response in countries, focusing on the high burden country first, DRC, Sierra Leone, Uganda, and Burundi, and also strengthening the response in other countries. So one thing, the surveillance, critical, the case management as well, and of course the lab decentralization that really help us to control the outbreak in a shorter time in many of those countries. So what we did, we create that platform as one team, one plan, one budget, and one M&E framework, where you have Africa CDC and WHO co-leading, and you have those 28 partners, GIZ, UNICEF, MSF, and others. So all the activities behind the plan, ensuring that in country we deliver the actual homegrown response.
What's been really encouraging is seeing the continental response to Mpox is now helping us tackle other rising outbreaks such as cholera. This year, we've already jointly rolled out integrated Mpox and cholera case management and IBC trainings for healthcare workers, as well as implementing facility assessment, supportive supervision, and mentorship for healthcare facilities and isolation centers across 5 countries.
This training has emphasized the need for early screening of suspected Mpox cases in our facilities and enhance surveillance in the community, because we know outbreaks begin and end with communities.
Now I have a better understanding of the definition of Mpox and how to define a suspected case, a probable case, and a confirmed case of Mpox. And another thing that caught my attention also was the IPC on donning and donning off. I think I've been taught a certain way, and this increased my knowledge over here with Africa CDC.
I'm going to ensure that I transfer this knowledge to my colleagues in the county, making sure that we organize trainings to transfer this knowledge on IPC and WASH on cholera management and Mpox.
Yeah, I've gained a communication skill whereby it will enable me to engage with the community when I'll be talking with them and mobilizing them.
We had actually a sit-on discussion where we managed to discuss the different challenges and the gaps we are facing at the facility level, and how we are going to address these challenges, and also this will be helpful for us to request for support in management of the Mpox patients as well.
Through collaborations with Africa CDC and WHO, GIZ is helping strengthen response capacities from continental to community levels. Although we've seen Mpox cases decline in recent months, the fight is far from over. We must build on the progress we have achieved together and build on this effective response model to reach countries that are still repeating cases. Beyond Mpox, this collaborative approach has proven that when we act together, investing in preparedness, coordination, and community engagement, we can respond faster and stronger to any outbreak. This is how we move from reaction to readiness and from crisis response to lasting health system resilience. Together, we can prevent the next pandemic before it begins.